Hi, friends. Good morning, and welcome to another edition of our Global Pandemic Midwifery Wisdom e-conference. We've been talking with midwives all around the globe and midwifery students even about the state of affairs in their community. We've been talking with them about how many increased clients they're getting. We've been talking with midwives about how they're handling it. And today we get the great pleasure of speaking to a midwife in British Columbia, Canada, to find out what her community is doing with preparation for and responding to the pandemic. So I'm excited to invite Jen on the call, and we'll get to hear about the condition of care in her community. Hi to everyone who's joining. Welcome. So good to see you all. Tanny's asking how the cat sitting's going. It's awesome. She woke me up today very early. But I'm so lucky. Jen on. Hear what Jen has to say about midwifery right now in British Columbia, Canada. There she is. Hello.
Hi.
Welcome.
Thanks.
And thanks so much for being willing to talk with us.
Yeah.
Can I ask you to do a little intro? Who are you? Where are you? How are you? Tell us what's going on.
Sure. My name is Jennifer Nguyen. I currently live in Vancouver, British Columbia. And how am I? I'm good.
Yeah.
It's 7 p.m. here, and so our neighbors are cheering for us. So I don't know if you've heard of this.
No, tell me.
Oh, okay. So at 7 p.m. in Vancouver and kind of all across the province and maybe the country, people go out on their balconies and they cheer for all the frontline workers that are working in the pandemic. So all the healthcare workers, all the cleaning staff, all the grocery clerks, like everyone has to be out. And so I just heard them out there. I usually am out there, but I'm doing this. So yeah.
Oh, well,
yeah, super nice.
We're cheering you too. How
Thank
amazing.
You. Thank you.
Yeah. And your spirit is okay? And
yes.
you feeling like you have a center to carry you through?
Yeah, I think at the beginning of this, there was a lot of stress and anxiety about what our practice was going to do to get ahead of this. And so that was a lot to think about. But now I feel like we've done a really good job and gotten in a groove of kind of a new way of practicing. And so I feel less anxious about it and just kind of, ready to do my work.
Okay. So you are practicing and you practice within your local hospital system. Is that correct?
So in BC, midwives are primary healthcare providers, and we have a clinic. And it's similar to a family doctor in that we have our own practice, and we do prenatal care, postpartum care in the clinic and in the community. And then we do births in and outside of the hospital as well.
Okay. So full spectrum.
Yeah.
So I saw in one of the chat boards that you shared some of the first protocols that we'd seen to respond to a potentially COVID positive population. And that was with British Columbia Hospital. Is that right?
So I work at a few different hospitals.
Yeah.
And so the thing is that as we know more and as we go day by day, things are changing as we're anticipating what our needs are, what our needs are going to be, and trying to be proactive about it. So there's a few different protocols that are being shared around from different health authorities. We're following the BC CDC, so Center for Disease Control.
Okay.
And they're giving us a lead on kind of what the guidelines should be and what the evidence currently is. And so what that looks like right now, the biggest thing is like, how do we as healthcare providers protect ourselves when we're doing our work? Specifically, the acute stuff, so births, in the hospital, but from a midwifery perspective, we're also doing births in the community. So we're doing acute care, but in the community. So we
Right.
need to protect ourselves in both of those settings.
Right.
And so by doing that, we're also preventing the spread of COVID-19 because
Yep.
we are going in and out of people's homes, to clinic, to the hospitals that we work at. And so it's really, that's kind of the huge thing is how do we get our personal protective equipment and how do we make that accessible as soon as possible, as there are shortages all around the world, and making sure that midwifery is not left out in that conversation.
Yeah. We're seeing that in the U.S. too. Well, so I know you can't go through the whole protocol, but would you just give us some highlights, some of the actual tried and true changes to policy or procedure that you've implemented that now you're like, everyone should be doing this. This is really important.
Right. So the practice that I work at is called Pomegranate Community Midwives, and we have changed a lot of our protocols on what we're doing. And I've made a little list here, but like 4 different categories. But first one is clinic. So how we're running clinic. Previously, we'd have 45-minute appointments with everyone in person. It gives us lots of time to talk about informed choice discussions, options for labor, birth, having a baby. And that's really changed. So we're doing 5 to 10-minute in-person appointments, and the rest of the appointment is virtual. So either like video like we're doing now or over the phone, and that takes up the bulk of their time. So usually 40 to 45 minutes chatting with people, and then organizing them to come to the clinic the next day for a quick 5 to 10 minute in person to do their blood pressure, feel heart rate measurements, all that stuff. And then second to that is the scheduling of visits. So we used to see people every 5 weeks, and then every 3 weeks as they get closer, and then every week. And now we've adopted the World Health Organization's prenatal schedule, which is 8 visits, which is different from our usual like 12 to 14 in pregnancy.
Right.
And so that has really changed, and that looks a little bit more like at the beginning, 12 weeks, 20 weeks, 26 weeks, 30 weeks. And then we get a little bit closer as we get closer to birth. So that's really changed too. And then how are we going to make sure that people are still feeling cared for, that they feel that everything is safe and they're reassured, that we're not missing anything because, things are further apart in terms of when we see them. Ultrasounds are still all the same. The lab work and screening options are all still the same because those are time sensitive, and we've really encouraged people to page us with any questions before in between their visits. We're on our pager 24/7 anyway, and so we really just want people to know that we're always there for them for that. And if anything, of course, seems a little bit more complicated in their pregnancy, then we'll see them more often. But for the very low risk healthy person, that we've adopted this new schedule that seems to be working really well. We've changed our furniture in our clinic to be completely wipeable, kind of head to toe, and we wipe things down religiously now. I'm like always either soap and water or cream on my hands. It's just like one or the other because my hands are so dry. And then the other thing is just emailing clients to tell them, as we find out what the newest protocol or guideline should be for maternity care, that we share that with our clients so then they feel like there's transparency in the process and that they are in the loop.
That's so important. That's amazing.
Super important. And then we're doing home visits in the postpartum. We used to do the first 1 to 2 weeks all at home, and then the rest, the last 4 weeks we're back in the clinic, and now we're just doing all at home except for the very last visit. Our equipment has changed a little bit from that. I dug some stuff out.
Show us. Show us.
So it's the usual blood pressure cuff and stethoscope and all that stuff, but the real thing that has changed is how we weigh our babies. So
Okay.
some people have the hard, like, clamshell scales.
Yep.
They're super
Yep.
nice, and you can completely wipe. They're really expensive, so
Yeah. Thousands, actually.
yeah.
Yeah.
So I didn't
Yeah.
do that. So
Yeah.
previously had my fish scale,
Uh-huh.
and then a cloth sling.
Yeah.
That was kind of like quintessential midwifery.
Yeah, it is.
But, if I'm doing a bunch of visits and I've got cloth that I can't completely disinfect in between, that's not so great.
Yeah.
And I've got multiple slings, but, doing so much washing if I'm,
Yep.
working full time, that's hard to do. So
Yep.
what we've actually found are these scale clips. And so they're like $3 each.
Uh-huh.
And they open up here like this.
Uh-huh.
And we actually,
Gotcha.
each client uses their own receiving blanket.
Yep.
And we kind of jimmy rig a little hammock with this. And then we click those on like that. And then the receiving blanket's here. And then we wave them that way. And then we can
Brilliant.
put these down. And that's been really, really helpful.
And where did you source those?
These are from Lee Valley. I don't know
Lee
if you
Valley?
Yeah,
No,
it was
tell
just
us
a
more.
hardware store.
Hardware store.
They're called Easy Clips with a K.
Okay.
But I love them. And I'm sure you could find something similar to this at anyone's like local hardware store, but that's what we found, and that's what's been working for our whole clinic. So that's what we use. And then, of course, our PPE in our home visits. So, the whole droplet precaution, goggles, mask, gloves, gown. Currently, right now, for asymptomatic people, we're doing gloves, mask, and goggles, the no gown. What I've been doing is I have a bunch of set of scrubs, and I just put on a set of scrubs outside the client's house, and then have my protective gear on, go in, come out, take off those scrubs, like on the street, put on new scrubs, go to the next house, and do that for however many visits I need to do. The masks have been a really hard thing to come by because there's such a shortage. I've got my own goggles, which is no problem, but it's the masks. And so we actually did a call out on Facebook to see if anyone could sew us the masks, because we needed to reuse them because we didn't have any medical masks.
Yeah.
And, we came up with like, from looking at all the different research, it's kind of jury's out right now. We were a little bit at the beginning, kind of like, there's something better than nothing.
Right.
And we have like a polyester layer, then a filter, and then a cotton on the inside. It's kind of what we've seen as the most effective for a cloth mask. And the response from the community was amazing. So many people, they mailed me masks. They just sewed masks while they were, social isolation, and they mailed them to me, and then I would chuck them in my washing machine to sanitize them. And then, and we've been making kind of our homemade PPE bundles for all the midwives in Vancouver. Because we've been getting a lot, which is amazing. While we're waiting for our hospital to provide us with the proper gear, because babies wait for nobody. So
they do not. Are you getting an increase in calls of people who want to birth at home instead of the hospital? That's what we're seeing around the globe. Are you seeing that there too?
Yeah. The first week that we started changing our protocols, I think I got like 4 calls that day from just the people that I was seeing, being like, I'm thinking of a home birth. And I was like, cool, let's do it. And I mean, that's not for everyone, obviously.
But for low risk, healthy people, it seems like it makes the most sense. And yet in some countries, and I know actually in Quebec, we're seeing that the midwifery organizations are saying no more home births. Can you speak to that?
So from what I understand, it's that the midwives are not allowed to offer home birth.
Wow.
So it
seems so counterintuitive.
Yeah. I think it's in a place where we are trying to reduce transmission for a very contagious virus. A lot of people that are healthy that, were maybe choosing home before, and then are more worried about going into the hospital, especially, it's a general hospital. People are coming and going that might be sick. A lot of reasons why people choose home birth is to avoid that in the first place, let alone in a pandemic. And so it's been really hard. I have a friend who's in Nova Scotia right now and pregnant and was planning home birth and is, quite upset that, they're kind of faced with the choice about, do I have my healthcare provider or not?
Yeah, that's a really extreme thing to do. Are you seeing across the different parts of Canada the same kind of exclusionary of doulas and partners that we're seeing in the U.S.?
As in not being able to come?
Yeah, what's happening with that?
So the change currently for asymptomatic people, so like no COVID, is doula is essential, and so they're still coming, right? So they're not counted as the support person in that way, because we know all the evidence shows doulas help.
Oh God,
right.
Why can't we get this information out? Of course they're essential.
Yeah. And then one support person only. So not like besides the doula.
Right.
If you're COVID positive, then nobody, unfortunately. But then you become much higher risk in terms of contagiousness anyway, but it sucks still. Like I can't.
Yeah, it's really sucks.
I can't really
And is Canada or British Columbia, where you are, separating positive moms and babies, like is happening in some places?
Not that I've seen yet. And from the hospitals that I've worked at, I haven't heard of any COVID positive people coming through as of yet. So we're not quite sure. All of our stuff right now is theoretical, because we know that that's happening in other parts of the country, and so we're thinking about what is best to do for our community when the time comes. But so far there hasn't been talk of that I'm aware of. Okay. Mm-hmm.
One of our viewers is asking about St. Paul's in Vancouver, saying apparently no doulas are allowed there. Do you have any knowledge of that?
Not so. I thought they were allowed. Yeah, I haven't heard otherwise. Yeah.
Okay. Well, so much has changed so rapidly. It's disorienting to try to even get a handle, and then new numbers and new figures and new studies and new opinions come out every day. Will you kind of switch gears and talk to us from like our human place and not our midwife brain place, and tell me how are you? What are you doing to keep yourself grounded and feeling stable? Because you do go to work most days, and I think you have a small person in your life.
I have a very not so small person in my life who loves saying the word no right now, and is a little bit trying. So sometimes work is the break.
Work is the break. I know. Yeah. Right? I remember being like, "Mommy's got a birth. I have to go. Bye." Go sit in my car for a while. No. Well, so what are you doing? Tell us about, like, if you could give midwives who are listening to the call, either here on Instagram or later when we move it over to YouTube, advice about how to keep themselves whole and together in this process.
Mm-hmm. I don't know if I have any advice, really. Like, we're all just kind of doing it together at the exact same time. And I don't think I have any sage words, except for what has worked for me and what has been really helpful is the support of my colleagues. So we at Pomegranate are usually 3 teams, and we've kind of notified our clients that we're kind of forming into one big team, and that's to help reduce the amount of people that need to be out working. And so if I'm at the hospital, so, we work at a couple different hospitals. So if I'm at one of the hospitals doing a birth and then someone else comes in, maybe an early labor needs an assessment, then I'll do that for them. So then my colleague have to come in. If I'm at the hospital discharging my client and other people need discharges, then I'll do them.
Right.
And then if someone's at the other hospital, same sort of thing. If someone's already out in the community in a certain area, then they might be doing those visits. Just so
Right.
we're limiting the amount of times that we are getting exposed and exposing other people.
Right.
And it's been really, really helpful to know that we've got each other's back. You know, that's kind of the philosophy of my practice anyway, that everyone is just kind of, you know, one big pomegranate family. And so lucky to work there. And I think that our colleagues just around the city are the same. And so we're all kind of brainstorming as a, you know, midwifery department, as a profession in this city, what can we do to call on each other to help so we're not exposing each other? We, you know, there's going to be a time when someone's going to get it.
Yeah.
And we've already had some people that are being tested, and thankfully they're all negative. But eventually, you know, someone will get exposed, or, you know, a few of us will get exposed, and we'll have to be out for at least 14 days, you know, while we wait for our test results. And so we need to rely on each other in order to keep midwifery going and keep our clients being cared for, because, like I said, babies wait for nobody. And so, you know, that's been a really amazing and progressive plan that the midwives in my community have worked together to form. And so that's been really helpful. I charted my car, even because I can't do it at home, and I can't do calls at home because of my little person. And I see all of my neighbors just parked on the street because our parkade has no cell service. And we're all like, I just see all these people that I know just working from home, but in our car, because we all have little people, which is really hilarious.
It's a whole new culture. Car design might even change to become a mobile office. I don't.
Yeah, I need more space between me and the steering wheel to put my laptop there. But it's a funny and interesting time for sure. Yeah. And then I live by the river, so I just have to go outside every day or I'll go crazy.
Yeah, I know. My heart is breaking for the communities around the globe that are truly shelter in place, not allowed out. It's just, I can't imagine, especially with small children. Can you even imagine?
No, yeah.
I mean, I talked to a midwife in Spain yesterday, 2 days, I can't remember the days blur together, but most people in Spain in the cities live in flats with like 2 windows, a few rooms, you know, and they are not allowed to take their children outside.
Yeah.
There's even recommendations that they figure out how not to take their pets outside.
Yeah.
And they can only go to the grocery store as singles, never as pairs. And there's certain hours of the day, depending on your social security number, when you can go out. And it's like truly lockdown. I can't even imagine what's happening for those children. I mean, every time I think about this, I just keep praying that we flatten the curve enough that there's this kind of outdoor experience that's allowed, because
it's a totally different, you know, it's a wild situation. I think BC has done a really good job so far, as to, you know, do our best to try and flatten the curve, because we're seeing what's happening around the world, and you know, nobody wants to get to that point. And, you know, we're having a hard time trying to function at the level that we're at now. And it's not, you know, it's just so different than what we're used to as a culture and a society, as a profession, the way we practice. And, you know, it's already so much of a change, and, you know, we're not nearly as bad as so many other countries.
Yeah. Well, I've heard some non-science reports, more like philosophical kind of reports, that this is a watershed event, changing the very fabric of humanity's experience, changing our societies. The children that grow up during this, now what they're saying, 18 months to 2-year experience, will have a remarkably different life world outlook than the generations that came before. And you're one of those moms who's raising a kid in quarantine. And my heart goes out to you. Before we say goodbye, do you have any words of advice, any love and kindness and suggestions for the midwives around the globe? Work with your sister midwives, sibling midwives. What else?
Yeah, I think it's I don't know, honestly. I really don't know.
You're in it. You're so in it. I get it.
I'm so in it, and I just lean on my colleagues for continued support because they've just been so amazing. And I think that, if you're able to do that, then that's, such a difference.
Yeah. Well, lots of texters below are saying that they love you, and I certainly am so grateful for you. Thank you for sharing with us in this little daily series we have going. The midwives around the globe learn from each other by virtue of getting to see each other's smiling faces and connecting. So thank you again for being one of those.
Yeah. No problem.
And really take good care of yourself. As I say at every visit, every one of these, you can't pour from an empty cup. So make sure that you continue to nourish yourself.
Very true. Thanks so much.
Yeah. Okay. Thanks again.
Bye.
Bye-bye.